as we move on to the next section, we want to talk about analysis and treatment options. And you work at Reboot RX, and maybe you could tell us about Reboot RX and whether I don't think you're on our poster. You probably should be. Can you introduce Reboot RX and tell us about what your contribution could be to the cases?
Yeah, I am not quite sure how we can help. So that's why I'm, trying to listen in and stay as engaged as I can in the meantime, but happy to tell you a bit about what we do at Reboot RX. So we are a nonprofit startup, and our goal is to get affordable treatments to patients faster using repurposed generic drugs. And we're developing AI technology to be able to sift through a lot of data on generic drugs to be able to systematically prioritize repurposing opportunities. And in collaboration with Brian, who really inspired our first deep dive, we selected prostate cancer for our first cancer type that we would focus on. And we've been working on that together since mid of last year, and engaged with a few of you here. So it's good to see you. So what we did with that project was we sifted through all of the PubMed studies that mention any of the 1,000 non-cancer generic drugs and prostate cancer, which is around almost 17,000 publications. And we ran them through our technology to be able to identify the relevant studies, which what we mean by that are studies where non-cancer generic drugs have been tested for the treatment of prostate cancer with clinically relevant outcomes that were reported. And so we've identified more than 80 non-cancer generics that have been tested in a clinical setting for prostate cancer, and then developed a scoring algorithm to be able to basically integrate all of the data across these clinical studies and rank the generic drugs with the most promise. So we've identified some promising candidates and are in the process of moving them forward. But our goal is not necessarily to promote any off-label use of the drugs right now. Our goal is to gather the definitive evidence so that we can be confident that they're both safe and effective for treating their new indications, in this case, prostate cancer. So while many of these have been tested in clinical trials, including randomized controlled clinical trials like phase 2 trials, for the most part, there isn't that definitive phase 3 evidence yet.